I've heard about Wolbachia, so I initially thought, okay, it must be another huge mosquito which eats these dengue mosquitoes. And then I go to this contest to see it's a whole different project. Hi everyone, welcome to another episode of The Positive Impact. Today we have with us Dr. Indika Weerasinghe, Public Health Medical Officer at the National Dengue Control Unit. Hi, Doctor.
Hi, how are you?
So we are here to talk about a new concept of mitigating this menace in Sri Lanka, dengue. So doctor, a very interesting thing to start off with. Is it dengue or dengue? Because we see this everywhere and it's quite...
Of course, there is nothing difference between dengue or the dengue. Usually when we pronounce in Sinhala, we used to say it's dengue una. But when it comes to the English, most of the Europeans, they used to say dengue fever. So there's nothing difference. The symptoms are same and the disease is the same.
Great. Thank you, doctor. Thank you very much. And how is the situation in Sri Lanka at the moment, the dengue situation in Sri Lanka?
Currently, dengue situation.
Because we hear on the news that it's...
Of course, these news headlines are correct because we are up to now, until now, up to today, this moment, more than 57,000 cases reported to the National Dengue Control Unit. So when compared with the last year, it's a huge increase because last year, our total dengue burden throughout the last year is something around 34,000. But until mid-September, it's almost 7th of September until today, 57,785 cases reported to the National Dengue Control Unit. So there's a definite increase compared to the last year. Yes, of course, that BNB due to the COVID and other things, there were restrictions of the movement. So that has helped to bring down the dengue. But when the restrictions are, all the restrictions are outraged, so people move from dengue prone areas to other areas, dengue is spreading rapidly. And the environmental conditions are very conducive for the dengue with the intermittent rains and the good humidity and high temperature is given a good environment for dengue mosquitoes to breed.
Yes. Yeah. So, doctor, I also had this question. So, dengue mosquitoes, they are born with the virus itself, or how do they carry it?
Now, the thing is like this. When a dengue mosquito, actually the virus carried by the dengue female mosquito, not the male mosquito. Right. The female mosquitoes, before laying their eggs, they need human blood protein to mature the eggs. For that purpose, they bite us. Right? When a dengue female mosquito bite a dengue infected human, they will infect it with the virus. Right? Okay. Once that female mosquito bite another person, because these mosquitoes bite several people to complete their blood meal. Right. So once that infected mosquito bite another person, he will infected with the dengue virus. So that is simply happened. And there's another theory behind that. When an infected mosquito female lays eggs, all the eggs contain virus. That's the theory. Okay. That's what you call the vertical transmission. So all the female mosquitoes, the female secondary generation will carry the mosquito. So they can spread the disease to the human. So that's the theory behind here, and there's a thing there. Yeah, that's a proven. There are scientifically proven, scientific evidence is out there.
Yeah. So if I got it right, so they can be a carrier as well at one point, and then they can be born as well as dengue mosquitoes if the mother was a dengue carrier, is it?
Yeah, when the mother has infected with we are not saying it's a carrier stage. Rather than carrier stage, when it's a carrier stage, it's a long process. But we are not saying it's a carrier stage, but they are infected with mosquito because mosquito is having a very short lifespan, not more than 1 month. The male mosquito's lifespan is 2 weeks and female mosquito's lifespan is 1 month. So they can infect it several times during that time period. If they have infected with a dengue virus.
Understood, doctor. Thank you very much. And what does your job role or your organization do, the National Dengue Control Unit? What are the responsibilities and the functions of your...
National Dengue Control Unit is a central unit at the Ministry of Health in prevention and control of dengue. So it's the central body responsible for dengue control and prevention in Sri Lanka, and it's a policy and planning unit. Right. So you can understand what I mean by the policy and planning. So we develop all the policies necessary for dengue control in Sri Lanka, and training where the doctors need training, where the public health staff need training in control activities, plus the clinical management. So all these activities carried out by the National Dengue Control Unit with other relevant sections of the ministry and the hospital sector. At the same time, we develop planning process for the budgetary allocation, because we are having a separate budget line for the National Dengue Control Unit. Through that, we are doing the planning process, how to manage dengue in the country. So there are several subcomponents there. For example, if I telling that I am working for the entomology and the outbreak response in the dengue control unit, and there's a separate unit for research, training and education and media communication, and there's another unit for monitoring, evaluation and planning. So there are different subcategories there, but under the big term of planning and policy, we are working as a one roof.
So we have another eminent personality from the National Dengue Control Unit, Dr. Lahiru Kodithuwakku. Dr. Indika, just give us a few minutes, because it's important for us when we talk about dengue and the other mitigating concepts. It's very important for us to talk about dengue, the symptoms, and how to identify this patient as well. So we will have a quick chat with Dr. Lahiru as well with that. So doctor, we spoke about dengue and how what's the situation of dengue in Sri Lanka, and we hear that it's in the rise again as well this year. So how can one identify or the symptoms of a dengue patient?
Right. Kavishan, now dengue is sort of a wide spectrum disease. In dengue, you have the normal dengue fever, then you have dengue hemorrhagic fever, which can be fatal as well. Then you have dengue shock syndrome, and sometimes you have what you call this complicated dengue. So it's sort of a wide spectrum disease. So because of this wide spectrum, you have different kinds of symptoms when you have dengue. Now, dengue is a viral disease, as you know. So for any viral disease, you have some very common features, like very high fever for a duration of 2 to 7 days, right? That is common to dengue as well. Then you have a headache. Then you have muscle pain and joint pain. But the specialty in this dengue is this muscle pain or this joint pain, we call it a break-bone fever. Now, it's sort of an excruciating pain in the joints. So that's sort of very characteristic of dengue fever itself. Then you have what you call this retroorbital pain or pain behind the eyes. That is also a characteristic of dengue fever. Apart from that, you can have a rash, then you can have vomiting and nausea as well. And those are the normal common symptoms of dengue fever. But there is now, as I told you earlier, you have a wide spectrum, then you have these dengue hemorrhagic fever and dengue shock syndrome as well, right? So when you have dengue hemorrhagic fever, you have what you call warning signs or warning symptoms of dengue. These are very important, because if you have these warning symptoms or warning signs, you have to admit to a hospital then and there as soon as possible, right? So these warning signs would be a persistent vomiting, right? A severe abdominal pain, bleeding from your gums, or bleeding through your nose, or bleeding through your bleeding through your stools, bleeding when you urinate, right? In case of a female, when you bleeding through your vaginal area as well, just like the days she is having her normal menstrual cycle, right? And then you have what you called anuria. That means no urine at all for 6 hours, or reduced urine output for the day, right? That is also a sort of a warning sign. Then, especially in children, you can notice irritability or drowsiness or refusing to feed. Those are sort of warning signs in children as well. So if you have these warning signs, it is sort of essential, right? Essential to admit to a hospital or consult a doctor then and there as soon as possible, because sometimes you might be having this very dangerous dengue hemorrhagic fever as well. So those are the basic common symptoms as well as warning signs of dengue.
Understood. So what you're saying is joint pain, pain behind the eyes, the rashes, those are the common things. And
and the muscle pain as well.
the red notices are these vomiting, abdominal pains, and this bleeding, what you said. So these are the symptoms, doctor. But how can one confirm this, that it's dengue?
Right. It can be several ways, Kavishan. Now, if you are living in a so-called dengue high-risk area, right? Now, time to time, Health Ministry as well as the National Dengue Control Unit declare these high-risk areas and communicate it to the public as well. Or you find that your neighbors are suffering from dengue and you consider it as a very dengue-prone area, then you have a fever for 48 hours, which is not subsiding, then you have to suspect you might be having dengue. That is the first instance, right? So if your fever is not subsiding for 48 hours, you can go to your family doctor, either family doctor or the nearest hospital. When you go there, they will sort of prescribe you or they will order you to do a full blood count. Now, in this full blood count, doctors would see several areas. First instance, it's the platelet count, as everyone knows. Platelet count will be reducing. Then WBC count, that is the white blood cell count, that would be reducing as well. Then you have what you call the PCV or packed cell volume, or they call it HCT as well, right? So that sort of gives you an idea about the viscosity of your blood, right? The density of your blood. So that can be increasing in some instances, right? So those are the three areas that you would sort of highlight in a full blood count when you have fever, dengue fever, right? Then there's another laboratory investigation, what you call dengue NS1 antigen test, right? This can be done during a period of 18 to 72 hours after the onset of fever. And if that test is positive, you have dengue definitely. But if that is negative, even it is negative, sometimes you might have dengue as well. So that is why, right? So that is why, because there are some issues with the sensitivity of this test. Any laboratory investigation, they have their own sensitivity, right? Just like that, dengue NS1 has these sensitivity issues as well, right? It's not a fallacy of the test itself, but it's the normal procedure of the test, right? Even if you have a negative NS1 antigen test, but you are still having these symptoms, it is important that you go and show this report to a nearest hospital or to your family doctor. Then he or she can tally with your clinical symptoms as well as other investigation reports and come to a conclusion whether you have dengue fever or not. Those are the two basic investigations you have to do. But remember, what is important is do the right test in a right duration of time. If you have fever, yes. If you have fever for more than 48 hours, go to your doctor and he will order the full blood count. Okay. If it is within 18 to 72 hours of the onset of fever, you can do the NS1 antigen, but both tests, while when you did it, you have to show it to a doctor. Okay. That is the most important.
So what you're saying is the initial thing is the full blood count.
Yes.
Within 48 hours.
In most instances, full blood count they do within 48 hours. Right. But NS1 antigen test you can do within 18 to 72 hours of onset of fever.
Understood, doctor. Thank you. Thank you very much. And okay, now you got the symptoms and you're confirmed after these investigations. What are the do's and do nots? Because there are so many myths that goes around these days. And what are the do's and don'ts that you would like to highlight?
Yes. Now it's a fever. No? It's basically dengue fever is some kind of a fever. Now, if you have fever, there are few things that you should do. Right. First, you must have a very good rest, right? Any strenuous exercises, any heavy work is not allowed when you have dengue because exhaustion, fatigue can come in, right? So have a good rest. That's the first thing. The second thing, only take paracetamol in correct dosage, and in recommended intervals. Now, when you take paracetamol, they have indicated this is the recommended interval that you should take paracetamol and this is the dosage of paracetamol, right? You only have to take paracetamol for fever control and pain relief, nothing else. painkillers, what we called non-steroidal anti-inflammatory drugs in medicine, that is painkillers basically. You don't have to take painkillers. It is sort of prohibited in dengue to take painkillers, such as diclofenac sodium, ibuprofen, mefenamic acid, right? Those kind of painkillers you can't take. If you take these painkillers, if you are having dengue hemorrhagic fever, you have a sort of possibility of going into bleeding. So that can sort of end in fatalities as well, right? And there is another group of drugs that you should avoid, that is what we called steroids, right? These include prednisolone, dexamethasone, right? Most of these drugs we take for these asthmatic patients, right? So you have to avoid those drugs as well. But suppose, Kavishan, now you are a chronic asthmatic, you are taking these drugs on a chronic sort of a regular basis, then you have to consult your doctor and ask him what I can do. Then he know how to reduce these doses and how to prescribe you drugs according to your ailment, right? And the other thing is you should have a good amount of fluids. You have to hydrate yourself. That's the other thing, right? Then be mindful about your urine output. When you have fluids, don't confine these fluids in just for water. You have to have some solutes as well. For example, you can have king coconut, you can have jeevani, you can have rice porridge, right? So it's important to have some solutes as well, right? Then mindful about your urine output, and don't take any red colored or brown colored liquids, because that can mimic bleeding. If you have bleeding with your vomiters, then that can mimic. So coffee, then all kinds of colas and soft drinks with red colored dyes, should avoid them, right? And the other important thing, now, if a child is having dengue fever or fever for that instance, there are other ways of reducing fever as well. You can use a tepid sponging. You can take a lukewarm water and do a sponge and do the sponging of his body. You can sort of treat him under a fan, right? So those kind of normal procedures you can follow as well. The most important thing is, if the fever is sort of continuing for 48 hours, it is essential that you go to a doctor or a hospital for consultation, right? Those are the basic areas. And please do not take any medication, either Western medication or Ayurvedic medication or traditional homeopathy, any medication, right? What we as doctors recommend, only paracetamol for fever control, right? Then you go to the medical officer or go to the hospital, and they will decide what kind of treatment you need, whether you need hospitalization or you need ambulatory care. That means the care at the home as well, right? Those are things that you should be mindful.
Great. So just to sum it up, so it's about rest and rehydration and sticking to your basics. Don't do anything.
Stick to your basics.
Yeah, stick to your
avoid those drugs that can cause bleeding as well.
Great. Thank you very much, doctor. That was very informative. So
thank you.
Dr. Indika on the mitigatory method that we are talking about. So that was Dr. Lahiru Kodithuwakku from the National Dengue Control Unit. Thank you, doctor.
Thank you.
Country. Yeah. And now the golden question, this is why I actually got in touch with Dr. Lahiru and you. I heard about this Wolbachia project, and I got to know about it because there was a contest which happened a few months back, and I was a participant myself. Because I was
really happy to hear about it. I'm really happy to hear about it.
Thank you. And it was very interesting because I've heard about Wolbachia. So I initially thought, okay, it must be another huge mosquito which eats these dengue mosquitoes. And then I go to this contest to see it's a whole different project. So to the benefit of the public, can you tell us what this project is and how it started?
Yeah, before come to the Wolbachia, I'll tell one thing, that dengue is identified in Sri Lanka in 1962. Since from 1962, we are having dengue in the country, but it became a public issue after 1996 with having a larger number of cases. So time to time, the dengue cases are rising. For example, from 1996 to 2000, we haven't got much of the cases, something around 1,500 cases per year. But from there's a huge jump from 2000 because our case load, yearly case load jump up to something around 5,000 to 10,000. So that is how it happened. Then in 2000, with the 2009 outbreak, it has jumped up to something around 30,000 to cases per year. Now, at current situation, last few years, we are getting something around 50,000 cases per year. So you see, during gradually, the dengue cases, reporting of dengue cases are rising. So we have done some conventional control methods. So if I said, you know that we advise, we aware the community keep their houses or the premises, working places, schools free of mosquito breeding. So that's the issue, because up to now we don't have a medicine for dengue, and we don't have a successful vaccine for dengue. Until you don't have a successful vaccine or a medicine, the only way we can control is controlling the mosquito breeding. We have to control the vector. Mosquito is the vector who spreading the disease. So we have to control the vector, because there is no specific treatment for dengue, such as, for example, if you get a pneumonia, we know that pneumonia, the bacterial pneumonia, there's antibiotics for the bacterial infection. But when it is a fungal infection, we are having antifungal treatment. But when it comes to this dengue virus, there is no antiviral treatment for the dengue. So that's the issue. And even if a person get infected, it's almost supportive treatment. There is no specific medicine for that. And you know that you might have get all your vaccines, and recently you got your COVID vaccine also. Though now we know that for protect ourselves before getting the infection, for the protection, we are having certain vaccines. From our childhood, we got the vaccines. But for the dengue, up to now, we don't have that much of successful vaccine, because dengue is caused by 4 types of dengue viruses: dengue 1, 2, 3, and 4. So if you, because in Sri Lanka, all 4 virus types are circulating. In different times, 1 or 2 are emerging, but all 4 types are circulating. So for control dengue, to prevent you are getting infected with dengue, then we should have a good vaccine which cover all 4 serotypes. Until now, at the world, there is no such a vaccine, because still most of the vaccines are under research. So they are still doing their trials. So up to now, there is no successful vaccine. So in that situation, still we have to go with the controlling of the vector, or the Aedes aegypti or the Aedes albopictus mosquito. There are 2 mosquito species that carrying dengue virus, Aedes aegypti and Aedes albopictus. So we have to go through behind them to control dengue. That's the scenario to go for these new techniques, because I used to use this Wolbachia techniques as a novel technique in dengue control, because this was introduced by the Australian team, World Mosquito Program. We usually say the WMP, or the World Mosquito Program. It's an initiative of the Melbourne University. A researcher called Professor Scott O'Neill. He's the inventor of this method. So he has invented that there is a bacteria which is naturally occurring in 60% of the arthropod species, called Wolbachia. So even certain mosquito species contain this Wolbachia. So it's not a infected bacteria. It won't infect anyone. It won't cause disease for the people, or it won't cause disease for the animals. So that's the most significant thing in this bacteria. In his research, he has found when the Wolbachia bacteria is inserted into the Aedes aegypti mosquitoes, the capacity or the capability of spreading dengue virus is bring down. So that's what really happened, because this initially he has done in a laboratory conditions. It's a strenuous process that he has undergone. So he was able to introduce the Wolbachia bacteria, which was taken from the fruit fly. The fruit flies, even we know the fruit flies, we know the moths, we know the butterflies. So all these arthropod species containing Wolbachia bacteria. So he has get a sample of Wolbachia bacteria from the fruit fly and introduced into the mosquito eggs. After several attempts, he was successful. And what he has found, and for the adult, the Wolbachia infected, the bacteria inserted adult female mosquitoes, then he has injected the virus blood, the human blood, which contain dengue virus. And there he has found, when the bacteria is within the body of the Aedes aegypti mosquito, he won't allow that virus to grow and that prevent spreading of the virus. Because if a mosquito with Wolbachia infected a person with dengue, but second time if it infected a healthy person, there won't be a spreading of the virus. So that's the basic scientific background behind that. So we have joined with this program, the Wolbachia. Some used to say Wolbachia. It's okay. Right. It's a Wolbachia or the Wolbachia. We are joined with the Wolbachia project in 2018. In our country, we have selected 2 dengue high-risk MOH areas for the pilot project, because you know that in 2017 we had the massive outbreak, something around 181,000 dengue cases report in the country and 440 deaths. That's a huge largest outbreak ever in Sri Lankan history. We had a dengue outbreak. So after that, we had a discussion with this Australian team. We have identified that we need to go for a new techniques rather than our conventional techniques. We may need to shift our dynamics to the new techniques to control dengue in Sri Lanka until we are getting a good vaccine and a medicine. So in that situation, we talked with them and we had initial discussions with them. And the Ministry of Health given their approval to Sri Lanka National Dengue Control Unit to go ahead with this pilot project proposal. So we conducted release of mosquitoes. So what we have done, it's a strenuous process. It's a wonderful process, but joining with that, so we keep something called the ovitraps in the field, and we collected mosquito eggs, Aedes aegypti mosquito eggs from these 2 MOH areas, the Modara Mattakuli or the Ward D1 MOH area from the Colombo municipality and the Nugegoda MOH area. So we collected the mosquitoes and we sent these mosquitoes to the Australia, where they have injected this bacteria to our mosquito eggs, because sometimes people say these are Australian mosquitoes that you are releasing in Sri Lanka. Exactly. It's not something like that, right? It's not something like that, because we conducted that proposal in a proper way with the approval of the Ministry of Environment, Directorate of Biodiversity, and we had ethical clearance from the Colombo Medical Faculty to conduct this pilot project, because we have to ensure that these are safe projects for the humans. Otherwise, people will get afraid that
exactly. So there can be a concept saying, okay, to beat dengue, they brought in another type of disease to Sri Lanka.
Sri Lanka, what another type of disease? But not to be worried. These are scientific proven, research proven documents are there. They are published in the well-recognized journals that the Wolbachia bacteria is not a pathogen. So that's the most important thing. So we send our eggs to the Australia, and they have sent back the infected eggs to us. So we brought the eggs to Sri Lanka, our own Sri Lankan eggs, and we release these eggs to the environment. So this is the part very important, because prior to releasing all these things, we had a very good community campaign, because you know that almost all the time, even in the news, even in the YouTube channels, in the Facebook, even in the social media, we used to say, now you have to remove all your breeding places. You have to bring down the mosquito density in your area to bring down the dengue menace. But what we are now taking, now we are releasing a new mosquito, dengue mosquito with a bacteria. So that's something totally different what we are previously taught. But we had a very good support from the community. That's the reason for success of this Wolbachia project. The people were really good. Our Sri Lankan community is really good. We exactly told that what we are going to do, and they accept that. They also said that we need an answer for this problem. So they were really happy, and we were successfully released 20 weeks of Wolbachia infected mosquitoes to the environment, and now we are in the monitoring process. Actually, we completed the release in last year May, and every 6 months now we are monitoring the Wolbachia frequency in these mosquitoes. It was conducted by the National Dengue Control Unit entomology team with the support of the World Mosquito Program. So, and we got a support from the Australian High Commissioner. He was really supportive with us in this project, and for the Australian aid is the funding agency for that, and they have already got funding from the Bill and Melinda Gates Foundation also for this project. Because I have to say the little bit of background, because if you Google in the Indonesia, Yoga, Jakarta, in that area, their dengue menace has been reduced 77% after 2 years of releasing of this bacteria in that area. So we are also expecting good results in Sri Lanka, but it's a pilot project. We have to identify what are the drawbacks in this project, what are the new areas we need to go. And currently, National Dengue Control Unit working with the World Mosquito Program or the Monash team to scale up this for the second phase to cover entire CMC area and few more MOH areas in the Colombo district. So stepwise, we are planning to introduce this novel technique into the Sri Lanka, but you can't do it in a single night. It will take some time, but stepwise you have to do that. Excuse me, Kavishan, I can't hear you.
Sorry, from my end. So yes, so very correct, doctor. I also saw it on the internet that this is a scalable and a sustainable model of mitigating this problem.
Yes, of course, as you mentioned, the sustainable model, there are different types of Wolbachia techniques carried out in Sri Lanka. For example, countries in Sri Lanka, Indonesia, Brazil, we are working with the World Mosquito Program. We are releasing both Wolbachia infected male and female mosquitoes. So when both male and female mosquitoes are released to the environment, Wolbachia infected both male, it's something called the replacement method. So these male, female mosquitoes mate with the male mosquitoes in the environment and they lay eggs. All these offsprings, which are getting to the new generation offspring, will contain Wolbachia bacteria. As I mentioned previously, that you asked me a question whether the second generation can carry the virus, same as the second generation can carry the Wolbachia bacteria. So there's something called the vertical transmission. So that's the advantages we are having. So we don't need to repeatedly release the mosquitoes during a certain time period. It is something around 12 to 20 weeks per cycle. So 20 weeks, every week we are releasing mosquitoes to the environment. When they come to a certain level, we can stop release. After that, we need to monitor for 5 years duration. But the Australian field trials and the Yoga Jakarta, the Indonesia field trials show that is more than adequate to have a sustainable control of the mosquito frequency, Wolbachia infected mosquito frequency. But countries like Singapore, they are releasing male mosquitoes. So that is called the suppression technique, where what they are doing is they are bring down the mosquito density there. Because when the Wolbachia is there inside female mosquitoes, they become sterile. They were not able to have their second generation. There won't be any offspring from these males. So that's what really happening. But the problem with that is then when the mosquito density goes down, you can stop release. But again, with the favorable conditions, when the mosquito density rising, you need to release again and again. So this is a process that take a lot of financial issues. Because country like Sri Lanka can do that, but country like Singapore can do that, but country like Sri Lanka, it's a difficult task with the current economic situation and even our economic burden. We may not repeatedly do the things, but we need some sort of sustainable method. So that's why we have joined with the this replacement method with the World Mosquito Program.
Great. And how can the public get involved, doctor? Because I think now the pilot projects have been done already. So are there any projects coming up in the near future where the public can get involved?
Yes.
Because I saw
Yes,
that the Mozzie boxes, you can keep it at your home and do it. How can people get involved?
Actually, Kavishan, now the mosquito boxes we are not distributing each and every house, because you don't need to keep mosquito boxes each and every house. That's the thing, because that depend on the number of mosquito boxes, how many number of mosquito boxes are keeping in a certain area depends on the density of the population density. If it is a dense area, for example, I'll tell you. In the Colombo municipality, in the CMC D1 MOH area, we kept one mosquito box for 50-50 grid, 50 meter grid. But when it comes to, because you know that Modara Mattakule area is a highly populated and highly population dense area. But when it comes to Nugegada area, we kept one mosquito box for 75 meter grid. So if you take a 75 meter grid, there may be something around 4-5 houses, but only one household maybe one for having a mosquito box. So that's something like that. So, but you can request, if the pilot project is going on in your area, you can request from the project team that I am also happy to have a Mossy box in my house. In that situation, after seeing the territorial matters, we may able to provide a Mossy box for you. But at the moment, we have already completed the releasing of the mosquitoes in the pilot area. But in the second phase, currently we are on a discussion and we are developing the agreement and we are on agreement phase. We may able to start it early next year. So we are expecting to start in early next year, the second phase. Then our people, our public who are living on these areas can working with the National Dengue Control Unit and the World Mosquito Program to bring some sort of a good result for dengue situation in their region. Kavishan, one
Yes,
more
doctor.
thing I want to tell you that you can't get a quick results this type of project. You need some time because to see a successful result, to see a good reduction in dengue, you may need to wait at least 2 to 3 years time duration. You need the data, patient data, reporting data, because you have to compare with the data with the previous data and the other MOH areas. So it will take some time to give us a good result, but these are successful projects currently
Exactly.
conducting in the world.
Exactly. Definitely. It's not a sprint, as people would say. It will be a marathon to beat this menace in Sri Lanka for sure. And thank you very much for all the support from your end, from the National Dengue Control Unit. And we should thank the Australian High Commission as well for being a partner of the whole thing, and Ministry of Health to spearheading the whole thing, and the general public who has come forward to be a part of this. From what we heard, we have more than 50,000 cases in Sri Lanka at the moment. So we'll do our part as what we are told, reduce these environments where dengue mosquitoes are being bred. So let's act as responsible Sri Lankans and support this cause, the novel concept of Wolbachia, to go into the Indonesian kind of an example where the dengue case reduction is up to a good 77%, or let's pray and hope that it's 100%. So that's I think. Thank you, doctor. Thank you very much.
Thank you very much, Kavishan, giving the opportunity to the National Dengue Control Unit to aware the community.